Welcome back to Health Bulletin, everyone. It's great to have you with us as we, try to get behind the numbers and the stories that really matter.
Always a pleasure to be here.
Today, we're going to be looking at a really major global health issue, and that is India's goal of eliminating tuberculosis, TB, by 2025.
An ambitious goal, for sure.
Hugely ambitious, right? 5 years ahead of the World Health Organization's global target of 2030. So we've got this new report that really tries to take stock of how much progress has been made, as we're getting closer and closer to this deadline. And we're going to try to, today, understand where India stands in this fight against TB. And we'll be looking at funding, if the right medicines and tests are actually available, and, really what it's like on the ground for the people dealing with this disease.
I think, taking a look at the ground realities is absolutely crucial. This report really gives us a chance to go beyond just like the big announcements and see what tangible progress has been made and where the challenges still lie. So yeah, we'll be looking at things like financial investments, the supply of those essential diagnostics and treatments, are they getting to the people who need them? And what are the experiences of those on the front lines of TB care?
Okay, so why don't we start at the beginning, right at the start, with the goal itself. So in 2018, India, made this big announcement, TB Mukt Bharat, meaning a TB-free India, by 2025. I mean, as you said, that is way ahead of the global target the WHO has set for 2030. So to kind of try to achieve this, they put in place this National Strategic Plan, NSP, to end TB.
Yes, that 2018 declaration was definitely a huge statement of intent. It really showed the commitment at the highest levels. But then, when you actually start to delve into the data, you really see how massive this challenge is. So if we go back to 2016, the TB case rate in India was at 211 per 100,000 people.
Wow, that's high.
Right. And then by 2022, that number had come down to 199 per 100,000.
Okay, so it's going in the right direction.
It is. It's a step in the right direction, absolutely. But I think it's crucial to understand what we mean when we say elimination, right? What does that actually look like? India's own target is to bring that number, that case rate, all the way down to just 44 cases per 100,000 population.
Oh, wow. Okay.
So that really highlights the scale of the task ahead. They've made progress, but there's still this huge drop that needs to happen in, a relatively short amount of time.
Absolutely. And, it is encouraging to see that decrease, like we are heading in the right direction. But yeah, you said there's a long way to go and the clock is ticking. And it's not just about the number of people getting sick, right? It's also about, how many lives are actually being lost because of TB.
Exactly. That's a crucial measure as well. And the National Strategic Plan, it also set a really ambitious target for reducing the number of deaths from TB. So the aim was to bring deaths down from 32 per 100,000 in 2017, all the way down to just 3 per 100,000 by 2025.
Wow.
A massive reduction. And the most recent data that we have from the India TB Report 2024, it shows that in 2022, the mortality rate was still at 23 deaths per 100,000. So again, it's lower than it was back in 2016, but there's still, a significant way to go to reach that target of 3 deaths per 100,000.
So, this is a huge endeavor. And to effectively fight any disease, right, you need resources. And a large part of that is, of course, funding. So the National Strategic Plan, that laid out this substantial budget, 123.27 billion rupees to eliminate TB between 2017 and 2020. Now, this recent report, what does it tell us about, whether that financial commitment actually happened, if that money was actually there?
Well, unfortunately, the report highlights, this significant gap between what was planned, what was on paper, and the funding that was actually made available. So of that 123.27 billion rupees that was outlined as necessary in the NSP, only 83.13 billion rupees were actually allocated.
Oh, well, okay.
So that works out to roughly 66% of the funds that they said were needed to actually meet that 2025 goal, at least for that initial period, 2017 to 2020. So while they had the plan, the financial backing, it just didn't fully match up.
Yeah, that is a considerable shortfall. And it makes you wonder, what was the actual impact on the programs on the ground? But the report does say that overall spending on TB care has actually gone up quite a bit when we look at, a longer time frame.
Yeah, that's an important point. When you look at the bigger picture, it's not all negative. So if we compare the spending on TB care and prevention in the 4 years leading up to the NSP, so from 2014 to 2017, the total spending was 19.9 billion rupees.
Good.
And then during the NSP period, it jumped to over 83 billion rupees. So we're talking about more than a fourfold increase. That's pretty significant. I think that shows a definite prioritization of TB compared to, how it was in the past. It's just
right.
that initial ambition in the NSP TB, they didn't quite manage to meet that full target in terms of the budget.
It's kind of like the money is there, but it's not necessarily translating into, a smooth process on the ground. And that brings us to a really basic but vital part of dealing with any disease. The medicine, having the right drugs available. And the report highlights, some really concerning issues around drug supply.
Yeah, what's really striking here is that even though we see this increase in spending on medicine, so 51.45 billion rupees were spent between, the fiscal years 2014-15 and 2023-24, and that's a quarter of the total funds given to the National Tuberculosis Elimination Program, we're still seeing these issues with, unreliable drug supplies and stockouts, and that's happening across the country, even in the past few months of 2024.
Still an ongoing problem.
Yeah, it's persistent. So you've got all this money going towards buying these essential medications, but they're not consistently reaching the people who need them. And that really raises questions about, is the supply chain working efficiently? Is it as robust as it needs to be?
And for a disease like TB, where you have to stick to, a very strict treatment regimen, sometimes for a long time, to actually be successful. I mean, these kinds of interruptions, they can be devastating, right?
Absolutely. And not just for the individual patient, but for the overall public health effort to control TB. When people can't get the medicines they need, it increases the risk that the disease will spread. And it can also lead to drug resistance, which then makes it even harder to treat.
Right. So tell me a little bit more about the treatment itself. What does the standard treatment for TB involve?
So for drug-sensitive TB, which is the most common type, the first-line treatment is a 6-month course of a few key antibiotics. The main ones are rifampicin, isoniazid, and ethambutol. And to make it easier for patients to take all these medications, because it can be a complicated schedule, they're usually given in what we call fixed-dose combinations.
Fixed-dose combinations.
Yeah, or FDCs. So this basically combines multiple drugs into a single pill. It simplifies things. And there are different types, like 2 FDCs with 2 drugs, 3 FDCs with 3, and even 4 FDCs that have all 4 of the main first-line medications. These FDCs, they're really the backbone of TB treatment. So making sure that they're available all the time is absolutely essential.
And a report actually gives us some specific numbers on how many of these FDCs are being purchased.
It does. So for the current financial year, 2024-25, the government has procured a pretty large amount, 32.6 million strips of these FDCs. And usually a strip has a month's worth of medication in it, like 28 tablets. That's a lot of medicine. But it's interesting because it's actually a big jump from the previous year.
Oh, really?
Yeah, in 2023-24, they only purchased 10.16 million strips.
That is a huge difference.
Right. So, you have these big shifts in how much is being bought year to year, and that could actually be part of the problem, contributing to this instability in the supply chain.
That makes sense. So it's not just about how much is bought overall, it's also about consistency.
Exactly. And then on top of the FDCs, they also directly purchased individual drugs like rifampicin and isoniazid. But even with all of these purchases, it hasn't stopped these shortages from happening.
Right, because the report mentions a letter from a group of doctors back in March 2024 that really details these widespread shortages, like across multiple states.
Yeah, that letter is, it's pretty alarming, because it really shows that this isn't just a one-off problem, it's happening systematically. So these doctors, they documented these shortages in Chhattisgarh, Rajasthan, Jharkhand, Madhya Pradesh, Maharashtra, Karnataka.
Wow, so many states.
Yeah, a lot of places. And what's important is this isn't just anecdotal evidence. There's a report by the Comptroller and Auditor General of India, the CAG, which looks at government finances. And they did a report on Bihar specifically, and they found that every single district in that state had experienced a shortage of at least one essential TB drug between 2016 and 2021.
Oh my gosh.
And in some districts, it was much, much worse. They were short of 17 out of the 26 drugs that are needed for TB treatment.
17? That's unbelievable.
It's a very worrying picture. It just shows that there are these consistent challenges in making sure those medicines actually get to the patients, when and where they need them.
So what are doctors actually doing, day to day to try and deal with these kinds of shortages? I mean, how are they coping?
Well, that letter that we talked about, it actually gives us a glimpse into some of the, I'd say, almost desperate measures that healthcare providers are having to take. So they talked about, in some cases, using pediatric formulations of the drugs when the adult versions weren't available.
Oh, gosh.
Yeah. Or trying to kind of piece together a treatment by supplementing the FDCs with individual drug components if part of the combination was out of stock. And in some really difficult situations, they were even having to reduce the number of days worth of medication that they were giving to patients just to try and make the limited supply last longer.
I mean, that's not ideal at all.
No, not at all. It's definitely not ideal from a clinical perspective. I mean, it could compromise how well the treatment works, the dosages might not be right, and it makes it harder for patients to actually stick to that full 6-month course of treatment. And all of that, ultimately it increases the risk of treatment failure and the development of drug resistance.
Yeah, and it sounds like, if we're talking about drug-resistant TB, it gets even more precarious.
It does. The report suggests that the situation is much, much more fragile when it comes to the drugs that are needed to treat multi-drug resistant TB.
MDR-TB.
Yeah, MDR-TB. And that's when the TB bacteria have basically become resistant to those two most powerful first-line drugs, rifampicin and isoniazid. So when you have MDR-TB, you need a different cocktail of drugs, second-line medications, and those are often more expensive, they can be more toxic, and the treatment's more complicated. And on top of that, the report found that there were even shortages of the basic lab materials that are needed to diagnose drug-resistant TB in the first place.
So it's like a double whammy.
Yeah, exactly. It makes it really hard to know what you're dealing with and then have the right tools to treat it. And in 2023, India had almost 64,000 MDR-TB cases. So making sure that they have a steady supply of these really vital drugs is absolutely crucial.
And the report mentions this one drug in particular, linezolid. And it seems like the procurement data for that drug suggests a very unreliable supply situation.
Yeah, linezolid is a key drug in treating MDR-TB, and it's worrying because there's a lot of fluctuation in how much is being purchased. So in 2020, they procured 6.9 million doses, and then in 2023, that number actually went down to 5.29 million doses, and then it went back up in 2024 to 6.1 million doses.
So up and down all over the place.
It's unpredictable, right, which is a problem when you're trying to plan treatment. And the overall procurement numbers, they don't tell the whole story about what's actually happening on the ground. Because, for instance, as of September 30, 2024, the entire national stock of linezolid was just 0.7 million doses.
That's so little.
It is, especially when you consider that the estimated need for the next 6 months was 2.65 million doses.
A huge difference.
Right, a massive shortfall. And we mentioned that letter from the doctors before. They also talked about a stock out of linezolid that happened in March 2024. So again, this isn't just a random event, it's happening repeatedly.
So we're seeing that, even though a good amount of money is being spent on buying these drugs, these stockouts are still a big problem, both for the first-line drugs and these crucial second-line medications. And the report talks to some experts who offer, their thoughts on what's driving these persistent issues. What do they have to say?
Well, Lena McGaney, she's got a lot of experience in pharmaceutical policy and access to medicines. And she says that these stockouts that keep happening, they aren't necessarily because there's just not enough money for buying the drugs. She thinks a big part of the problem is these delays and inefficiencies in the tendering processes that the government uses to buy these drugs.
So like bureaucratic hurdles?
Exactly. All the paperwork and the slow processes. So even when the money is there, those delays can lead to gaps in the supply. But then you have Dr. T. Sundaraman, who's a public health expert. And he's worried about this trend where states are starting to buy drugs locally on their own to try and deal with these stockouts.
I see. So going around the national system.
Yeah, they're trying to find workarounds, but he's cautious about this. He thinks it could be harder for individual states to negotiate good prices, and more importantly, he's worried about quality. If every state's buying on its own, how do you make sure all the drugs are effective and safe? So he really thinks the solution is to have a more centralized national procurement system.
So basically streamline the process, make it more efficient, make sure the quality is consistent, and potentially even get better prices by buying in bulk.
Exactly. So let's switch gears a little bit now and talk about another really important part of tackling TB diagnostics. Being able to identify cases early and accurately is absolutely crucial for stopping the spread of the disease and making sure people get the right treatment as quickly as possible.
Right, because if you don't know who has it, you can't treat them, and you can't stop them from passing it on to others.
Precisely. And the report has some concerning figures about how much is actually being invested in diagnostics.
Oh.
Yeah, it seems like there's a big mismatch between how important diagnostics are and how much money is actually going towards them. So the report says that up until the 2023-24 financial year, only a tiny fraction, like just 2.1% of the total budget for the whole TB elimination program had been spent on diagnostics.
Wow. 2.1%. That's shockingly low.
It is. It worked out to just 4.34 billion rupees. And even when you look at the total spending on diagnostic tests over a longer period, like from 2014-15 to 2024-25, it only comes to 10.59 billion rupees. So given how central testing is, that just doesn't seem like enough.
It really doesn't. And we've already seen with those drug supply issues, like there are those CAG reports, and there was one from Bihar in 2020 that highlighted problems with diagnostics. Even basic facilities.
Yeah, some districts just didn't have the facilities they needed to do those essential tests. And that raises a big question about whether people across the country are actually getting equal access to diagnostic services.
Right, because even if the money's there, if the facilities aren't there, it doesn't really matter.
Right. And the government, they've said that they've put procurement systems in place to make sure there's a more stable supply of the things needed for screening and diagnosis. But the spending data and these audit reports, they really suggest that there are still big challenges in, building up that diagnostic infrastructure, making sure those resources are actually available at the local level, where people actually go to get care.
And I know that the National Strategic Plan, it actually called for a shift to more modern technologies, like moving away from that traditional smear microscopy.
Right. The NSP was very clear about that. They recommended switching from smear microscopy, which is, over 100 years old, to these newer nucleic acid amplification tests, or NATE machines. And NATEs, they're just much more sensitive, much more reliable in detecting the TB bacteria. And this recommendation was also supported by the Parliamentary Standing Committee on Health back in 2020. They specifically said, we need to increase the procurement and use of these domestically made TrueNat cartridges.
So, the plan was there, the recommendations were there, but has it actually happened?
Well, that's the thing. It seems like this transition to these more accurate and faster tests, it just hasn't happened on the scale that was envisioned.
It's fallen short.
Yeah. The data from the India TB report 2024 shows that only about 26.2% of all the TB tests done across the country were using these made-out technologies. The vast majority, like 73.8%, were still using that old smear microscopy technique.
Wow. I mean, we're talking about a technique from 1882.
It's incredible, right? And to still be relying on that old, less sensitive method, it's worrying. It means we could be missing cases, especially in children, and it makes it harder to catch drug resistance early on.
So can you walk me through, what's the actual difference between these two tests? What do they offer?
Sure. So smear microscopy, it's cheap, it's relatively simple, and you can get the results pretty quickly, often right there at the primary health center. But the problem is it's not very sensitive. So it can miss a lot of TB cases, particularly in people who don't have a lot of bacteria in their system. So that could be children or people with HIV who have TB.
Okay.
Then you have the molecular tests like NAT, which are more accurate. And they can also tell us about drug resistance, which is really important. But those tests usually have to be done at a higher level of the healthcare system, like at the district level. And it might take a bit longer to get the results, maybe up to a week.
So there are pros and cons to both.
Exactly. And Dr. Sundaraman, he makes a really good point about this. He says that, yes, we need to move to these newer technologies, but it has to be done carefully. We need to make sure there's a reliable supply of the materials needed for those tests. And we need to support the development of domestic manufacturing so we're not completely dependent on imports. So it's about balancing that access to the older, more readily available methods with the improved accuracy of the new ones, while also, making sure we're building the infrastructure and the supply chains for the future.
It's a lot to juggle.
Yeah.
So we've talked about money, we've talked about the drugs themselves, the testing, but let's talk about the people, the human element, the healthcare workers. The report also shines a light on, this ongoing issue of staffing shortages and also the lack of essential infrastructure for the TB program.
Yeah, this is, in a lot of ways, the most fundamental part of the whole program. You can have all the money and all the best drugs in the world, but if you don't have enough people and you don't have the right facilities, it's not going to work. Yeah. And unfortunately, the report shows that even as recently as 2024, a lot of states were reporting that they had significant vacancies in these key positions within their TB programs.
So even now, as we're getting close to 2025, this is still a big problem.
It is. It's been a recurring problem in a lot of states. And it just really hinders their ability to do what they need to do.
And the report gives some really specific examples of this, right? Like with Andhra Pradesh.
Yes. The CAG report on Andhra Pradesh found that over 12% of the jobs within the National Tuberculosis Elimination Program, the NTP, were just empty. And that impacts everything, being able to follow up with patients, doing contact tracing, getting out into the community and raising awareness. The state government did try to fill some of those positions, but it just highlights that this is a constant struggle. And then you have the audit in Bihar from 2020, and that found an even more concerning situation.
Really?
Yeah. All of the positions for these public-private mix coordinators, they were vacant. And those coordinators are supposed to be the link between the public health system and the private healthcare providers, which is really important for getting everyone on the same page and working together to control TB. And on top of that, they found that only about 29% of the senior treatment supervisor positions were filled. So there's just not enough supervision, not enough oversight at the ground level.
It sounds like, it's not just about having enough people, but it's also about the actual physical spaces, the buildings, the facilities that you need. And Uttarakhand, they're a good example of that.
Yeah. The audit in Uttarakhand showed that they weren't even able to spend all the money that was allocated to them. They couldn't spend the money.
Because they didn't have the staff to carry out the programs. So the money that was supposed to be for a state-level TB lab and for the Nikshay Poshan Yojana, which is that really important program that gives nutritional support to TB patients, it just sat there. And then the audit also looked at the main TB sanatorium in the state, and they found that it was in really bad shape. Not enough beds, not enough staff, no CT scanner. The building itself was in a bad condition. So that obviously has a huge impact on the quality of care that people can receive.
And Maharashtra is dealing with huge doctor shortages as well.
Yeah. As of March 2023, a whopping 74% of the doctor positions for TB in Maharashtra were vacant. And, that's a massive problem. It means they just don't have the people to properly diagnose and manage TB cases. And the report also shows that this lack of staff is having real consequences.
What kind of consequences? Like, they're not testing enough close contacts of TB patients. In 2022, they found that 8% of contacts weren't even tested. And then giving preventative therapy to children who've been exposed to TB, that's also really low at only 59% in 2022. And there are a few reasons for that. Like, sometimes they just didn't have enough of the drug isoniazid, which is used for prevention. And then sometimes patients refused to take it, and sometimes private doctors were reluctant to get involved in that preventative treatment.
And even the program that gives financial support to patients, the Nikshay Poshan Yojana, that's facing challenges in Maharashtra too.
Yeah, that's supposed to be a direct benefit transfer to patients' bank accounts to help them with the costs of having TB. But in 2022, they only reached 79% of the patients who were eligible. And part of the reason for that is that some people just don't have access to a working bank account.
It's like for every step forward, there's another obstacle. And it's the same story in other states too, right?
It is. Odisha, Haryana, they're both reporting similar problems, not enough staff, money not being used properly. And in Haryana, they even had problems with how they were recording data, which is just, it raises concerns about the accuracy of the information they have. And then there's this TB hospital in Haryana that was declared unfit for use back in 2015, and it's still operating.
Oh my gosh. So it's pretty clear that these staffing shortages are widespread. And Dr. Sundararaman makes a really important point about this. He says that just putting money into the TB program isn't enough. You need to strengthen the entire health system.
Yeah, he's absolutely right. He says you need to make sure there are enough staff at all levels, you need functional facilities, you need to involve the community. And he thinks that a big part of the reason why money for TB often goes unspent is because they just don't have the people to actually do the work.
Yeah, it makes sense. I mean, you can't implement a program if you don't have the people to do it.
Right. And finally, I think we have to talk about the people who are most affected by this disease, the patients and their families. The National Strategic Plan, it had this really clear goal that nobody should suffer financial hardship because they have TB.
Right. So no family should be pushed into poverty because of a TB diagnosis. But is that actually happening?
Well, sadly, no. A study by the Indian Council of Medical Research, the ICMR, that was published in December 2024, found that over 45% of families in India are still facing what they call catastrophic expenses when they're trying to get care for TB.
45%, that's huge.
It is. And it means that the costs, the medical bills, the travel, the time off work, it's all so much that it's pushing these families deeper into poverty.
That's heartbreaking. And I know that India has this program, the Nikshay Poshan Yojana, that's supposed to help with those costs, right?
Yeah, that program gives 1,000 rupees every month to every TB patient while they're on treatment. It's not a lot, but it's something. But the report shows that, even that support isn't reaching everyone who needs it. Yeah, a CAG audit in Chhattisgarh in 2024, it found that over 17% of TB patients there didn't get the money they were entitled to under that scheme. And there could be a lot of reasons for that. Maybe people aren't aware of the program. Maybe they have trouble accessing their bank accounts. Maybe there's some administrative problems. But whatever the reason is, it's a failure to deliver on this really important promise to protect people from those devastating financial consequences of TB.
So it seems like, we've got this report that shows this really mixed picture. On the one hand, there has been more investment, and we are seeing some progress in terms of fewer cases and fewer deaths. But on the other hand, there are these huge multifaceted challenges, making sure the funding actually gets to where it's needed, fixing these drug and diagnostic supply chain problems, and addressing those critical shortages of staff and infrastructure. Those are all massive hurdles that have to be overcome if India wants to achieve its goal of eliminating TB by 2025.
I think this report really shows how complex it is to deal with a public health issue like TB, especially in a country as vast and diverse as India. It's not just about money. It's about making sure that money is used well. It's about having strong systems for getting medicines and tests to the people who need them. It's about having enough trained healthcare workers and the facilities they need to do their jobs. And it's about having social safety nets that actually work and protect the most vulnerable people. There's a lot to do, and it's going to take a lot of effort from everyone involved.
So for our listeners out there, thank you for joining us on this edition of Health Bulletin as we looked at this new report and tried to untangle some of the complexities of India's goal to eliminate TB. What we've talked about today really shows the huge effort that's going on, but also shows how persistent these challenges are, especially when it comes to things like funding, supply chains, and the healthcare infrastructure itself.
And I think it's important for us to stay informed and to keep the pressure on to make sure that the resources are there, the systems are working, and the people who are most affected are getting the support they need.
Absolutely. And we really encourage you to, like, share, follow Health Bulletin for more in-depth discussions on crucial health issues like this one. Thanks for listening.